Good evening, everyone, and welcome back. Today we're talking about a new case. This is a female hair transplant case with Afro-textured, tightly curled hair. The goal was to lower the hairline, reduce the forehead size, and reshape the sides for a more feminine look. Let's quickly go over the details of the procedure. The surgery was performed on June 16th, 2023. So it's been almost 1 year now. She is 34 years old, no medical conditions, no smoking, no alcohol. We transplanted 3,000 grafts. The team included 1 doctor and 3 assistants, and I supervised the case personally. The technique used was standard FUE, not sapphire, just classic FUE with a regular steel blade. And this decision was based on the nature of her grafts. Afro hair grafts are thick and curved. Sapphire blades create very small channels, which can make implantation more difficult in this hair type. So standard FUE was the safer choice. The procedure lasted about 6 hours. That's the general overview. Now let's look at the photos step by step. The main issue was a receded hairline. The sides also had a very weak and unattractive shape. So she absolutely had a good reason to consider surgery. As you can see here, the lateral areas were not aesthetically pleasing. At the same time, we had the opportunity to lower the hairline and create a natural feminine design. In women, the hairline should not have sharp angles. It should be soft, smooth, and slightly rounded. That's exactly what we aimed for. There was also a small detail here. We intentionally avoided very high density at the temples. We didn't want it to look masculine, so the plan was gradual density, softer at the bottom, and increasing progressively upward. This way, it doesn't suddenly look thick like a male hairline. Everything blends naturally. Another important point, we didn't only transplant the front line, we also implanted grafts between the existing hairs. So the transplanted area actually goes deeper inside. This creates proper blending between the new hair and the original hair. As you can see, the implanted zone is quite wide, not just a thin line. Now, regarding shaving, we decided on full shaving. Afro hair extraction is very challenging, and we needed maximum access to the donor area to safely reach 3,000 grafts. If we could have extracted more, we would have, because the recipient area was large and required strong density in the front. Don't let the donor density fool you. Afro hair is extremely difficult to extract. If this was straight hair, we might have reached 5,000 grafts. But with great effort and careful work, we safely achieved 3,000 grafts. Now let's look at 1 month post-op. At this stage, the transplanted hair has shed. This is completely normal. The area looks almost like before. The donor area still appears stressed, and you can clearly see the shock loss phase. Keep in mind, her natural hair was not very dense to begin with, so extracting 3,000 grafts from this hair type is not easy at all. We advised her to use minoxidil on the donor area to stimulate blood circulation and speed up recovery. Now, at around 3 to 4 months, you can see improvement. The donor area starts to recover, and the frontal area begins filling in. She was very happy at this stage because the biggest concern was finally improving. At the next follow-up, the hair is still short, but the density looks very promising. The hairline is taking its final shape. Afro-Caribbean hair is one of the most complex hair types in transplantation. It is even more challenging than typical African hair. The donor area was still recovering, but curly hair helps camouflage minor gaps. Now, finally, after 1 full year, we can see the final result. The hairline looks dense, natural, and beautifully shaped. The density transitions gradually from bottom to top, exactly as planned. The frontal density is strong. The donor area looks natural and stable. There are minor areas of lighter density, but nothing noticeable. Sometimes biology sets natural limits. But overall, the result is excellent. Let's quickly compare before and after. Look at the difference. Look at the hairline. Look at the density. Look at the forehead distance before and now after. The change is significant. She is a beautiful and very elegant lady. She is originally from South Africa. It was truly a pleasure working with her. Now her hair is longer, so the hairline design is less visible, but the overall aesthetic result is fantastic. She is very happy with the outcome, and that's what matters most. I wanted to share this case so you understand that hair transplantation requires patience. Results do not happen overnight. You don't wake up the next day with full hair. It takes months. It requires commitment to the treatment plan, patience, and realistic expectations. Hair transplantation is a medical procedure. Like any surgery, it has a success rate, it has risks and possible complications. Thankfully, the risk level is much lower than many other surgeries, but it is not magic. It requires patience and trust in the process. I hope everyone achieves the beautiful result they desire. I won't make this video any longer. If you'd like to follow more cases, you can find us on Instagram. You can also contact us via WhatsApp. The number is in the video description. We provide full cosmetic procedures, including hair transplant, dental treatments, and eye procedures. Patients visit us from all around the world. Thank you for watching, and I'll see you in the next case.